Okay, good morning. First, I want to welcome you all to the American College of Preventive Medicine Vaccine Confident Pediatric Rally, and thank you for taking time out of your busy schedules to engage with ACPM and communicating the importance of pediatric vaccination and the critical role of the preventive medicine workforce in championing the health of individuals and populations. My name is Kate Shreve, Director of Programs and Grants for the college. It is my pleasure to introduce you to ACPM's president, Dr. Mirza Rahman, who will serve as your host and moderator for today's rally. In addition to serving as president of ACPM, Dr. Rahman is the vice president and chief safety officer at Organon. He is responsible for leading and setting the broad strategic direction for pharmacovigilance for this multinational company. Can you all hear me?
Yep. Yes.
In addition, Dr. Rahman is founder and president of the Guyanese Diaspora Charity, a nonprofit organization set up to help people of Guyanese descent, both in Guyana and America. In fact, Dr. Rahman joins us today from Guyana. Prior to practicing pharmaceutical medicine, Dr. Rahman was an assistant professor in the departments of family medicine, epidemiology, and biostatistics, and the Ireland Cancer Research Center at the Case Western Reserve University School of Medicine. Prior to this, he served as the medical director of the Tri-Community Health Center in Suffolk County, New York. Since 2004, Dr. Rahman has been a volunteer attending physician at the Bryn Mawr Family Practice Residency Program, where he teaches evidence-based medicine. In 2013, Dr. Rahman created the ACPM Otsuka Pharmacovigilance Physician Program in Global Medical Safety. Dr. Rahman completed his general preventive medicine and public health residency and his family medicine residency at the Stony Brook University School of Medicine. He also completed the advanced management program at the Columbia Business School, earned his Master of Public Health degree from the Columbia School of Public Health, his Doctor of Medicine degree from the Stony Brook University School of Medicine, and his Bachelor of Science degree from the Sophie Davis School of Biomedical Education at the City College of the City University of New York. He is a fellow of the American Academy of Family Physicians, the American College of Preventive Medicine, and the College of Physicians of Philadelphia. Dr. Rahman, the floor is yours.
Thank you so much, Kate. Good morning, everyone. Welcome to this Vaccine Confident Forum that is being hosted by the American College of Preventive Medicine. I have with me my colleague, Dr. Wendy Lane, and I will introduce her shortly. But here we are talking about vaccine, and we're going to specifically focus on pediatric vaccines, because while we know the value of vaccines, there's been a lot of challenges, and we call it hesitancy, which has come around because of specific programs and messages that come forward that maybe lack the evidence. And this is what we're trying to do with this Vaccine Confident campaign, which was designed at the height of the COVID-19 pandemic to leverage the critical voices of preventive medicine physicians to promote the safety and efficacy of vaccines. Vaccines are well recognized. The CDC in an MMWR report had said that vaccines are one of the top 10 public health measures that led us from the challenges of the last century into this one. And yet here we are in 2023 being challenged about the use of vaccines. So we're looking to all of you as preventive medicine physicians to take the message and go forth with this campaign. And we need to expand it to better educate our stakeholders on the importance of routine vaccines. We're not talking about things that when people go traveling to distant parts of the world, we're talking about routine vaccines, mumps, measles, rubella. We're talking about things that should or have been eradicated, that because of a lack of vaccines, we're seeing them re-emerging and causing preventable deaths. This is something that should not be happening in this country or in various places around the world. And we have children who are unvaccinated who are now getting into trouble. And so why now? We talk about pediatric vaccine outrage. For the first time in decades, we've got children who are exposed to diseases that I said were previously controlled by vaccines. Confidence in routine vaccines has dropped. By the end of 2021, more than 26 million doses of routine vaccines were missed. As we start the current year of school, we're not getting enough kids being vaccinated. See, nearly a tenth of them are left unprotected from preventable diseases like measles. And we need to make sure that we deliver the care, administer the vaccines, and have parents and other stakeholders recognize the value of vaccines. Yes, we shouldn't have to do this, but if we have to, then we must, because it's about protecting the health and well-being of the children as they come up, and answering questions and making sure we give them the data and use the evidence that we have, because that will convince them, in addition to making sure that we share the dangers of leaving children unvaccinated. We've got to follow that CDC recommended vaccine schedule. And as I talked about it in 2023, a lot has changed. You've got COVID vaccine and boosters added to the CDC routine immunization schedule. There's updated guidance and recommendations for influenza, pneumococcal, measles, mumps, rubella, hepatitis B. You've got a new RSV vaccine that's been approved, and new COVID-19 boosters recently approved. And yet, with all of that, there is this vaccine hesitancy, because there are people who make unsupported assertions about the safety and efficacy of these vaccines, that parents, out of an abundance of concern, given false information, are reluctant to get their children vaccinated. And this puts those children at risk, and then runs the risk in communities of spreading disease and creating hotspots around the country where children can get sick and die. Slide, please. And so why us? We as preventive medicine physicians, we can build confidence and help protect communities from the next public health crisis. We need to talk to caregivers and patients about vaccines. Leverage the vaccine confident tools, messaging, and resources, and engage in social media. This is a powerful tool for us to get our message across. And so with our institutions and in our communities, leverage social media using the vaccine confident tools to get the message across that we need to protect the health of our communities, particularly children, as they get ready for school and beyond. Maureen?
Hi, I'm Maureen Abel, Senior Director at BRG Communications, and I will be providing a brief overview on the Vaccine Confident campaign itself. So just as Dr. Rahman mentioned, there has been critical drop in mistrust at large around vaccinations. And so many of you on this call will be familiar with the Vaccine Confident campaign, which was launched just over 2 years ago with support from the CDC. And in the summer of 2021, there was around a 60 to 65% confidence rate among all healthcare providers in the new vaccines for COVID-19. Yet when surveyed, ACPM members expressed a 98% level of trust in these new immunizations. And so ACPM leveraged their voices as trusted experts to help get the word out, and recruited its own members to serve as key message ambassadors to bring the message forward in local communities at the grassroots level and even at the national level through a sustained media outreach program. But since that first year of the program unfolded, we saw a drastic decline in routine pediatric vaccinations, and so began to leverage ambassadors to answer questions. I know you'll hear from Dr. Lane in just a moment about some of her work in that area, but to help address questions of parents and caregivers and expand our reach to further parts of the country. And so we've since been able to not just expand the message, but also expand our ranks in terms of ambassadors helping to get the word out. So the ambassador program, it really, it launched with an imperative to leverage the trusted voices of ACPM's greatest asset, its membership, its trusted members who consist of preventive medicine physicians who are trusted in their communities who have a voice and who work in all different facets of healthcare. And so the program, when it launched in 2021, we had a small but mighty crew of about 10 to 20 early adopter ambassadors, but has since expanded to more than 100 ambassadors who are working across the country to provide assurance to not just patients, but also to their key stakeholders in local communities about vaccines at large. And we have seen ambassadors participate in, Dr. Lane herself has given testimony to the Baltimore City Council. We've had ambassadors working in local vaccine and testing drives that have served immigrant and refugee populations. We have had ambassadors in communication with military spouse programs, kind of spreading the message. So really leaning into the strengths and unique interests of each person to help get the word out in one consistent voice, but in unique ways to help meet audiences where they are. So because I mentioned one of our fantastic ambassadors, Dr. Wendy Lane, I'd like to turn it back over to Dr. Rahman for a brief Q&A.
Terrific. Thank you, Maureen. As I introduce Dr. Lane, I want to say that I knew the other Dr. Lane, who was my residency director, Dr. Dorothy Lane. But this is Dr. Wendy Lane. She's a clinician and researcher at the University of Maryland School of Medicine. She's board certified in general pediatrics, child abuse pediatrics, and preventive medicine. Dr. Lane received her medical degree from the University of Pennsylvania and then completed her pediatric residency and master's in public health at the University of North Carolina. She completed a preventive medicine residency at the University of Maryland and then a fellowship in child abuse and neglect at the Children's Hospital of Philadelphia. Dr. Lane is currently an associate professor in the Department of Epidemiology and Public Health and the Department of Pediatrics at the University of Maryland. She serves as the medical director of the Baltimore Child Abuse Center. Dr. Lane also serves as the director of the Preventive Medicine Residency Program, the director of community outreach of the Master in Public Health Program, and co-director of the program in health disparities and population health at the University of Maryland School of Medicine. And most recently, she was appointed to serve as the chair of the State Council on Child Abuse and Neglect. Welcome, Dr. Lane. And before we get started, maybe you can tell us a little bit about what got you into a career in preventive medicine and pediatrics. And thank you for joining us. You are on mute.
You'd think I'd learned by now. Thank you so much for having me. So how did I get into this? I have always had an interest in child well-being. And so when I decided on a career in medicine, pediatrics was the obvious choice for residency training. Like many of you, I wasn't familiar with preventive medicine when I started medical school. And as I applied for residency, I discovered that UNC had a combined, well, not really combined, but had a pediatric, their primary care residency programs. They encouraged individuals in those programs to apply for preventive medicine. And it really seemed like a perfect fit because both are really focused on prevention and well-being, and the preventive medicine residency allowed me to gain additional skills in public health and clinical research.
Terrific. Well, thank you for sharing that. And also thank you for being a vaccine confident ambassador. What made you decide to do that?
So from the time that I started practicing pediatrics, I have been hearing some vaccine hesitancy from parents and some resistance. This was all exacerbated by the pandemic. And I do some of my work in West Baltimore, which has a high population of low-income individuals and African-American individuals. And there was a lot of mistrust of them, and still is a lot of mistrust of the medical system. And some of that has translated into mistrust of vaccines, and the community was getting hit harder by COVID. And we wanted to make sure that messages about the COVID vaccine and other vaccines were getting out, and getting out by trusted individuals.
Mhm. And what are some of the, you talked about some of the vaccine hesitancy. What are some of the common misconceptions that you hear when you see parents and talk with them?
So just about 2 weeks ago, I was talking to a parent and recommended the HPV vaccine. And she said, I'm not going to do that because every person I know who has gotten the HPV vaccine has had a pap smear afterwards that was abnormal, which surprised me. And I provided some education, but there's also a common resistance to receiving flu shots. People think that getting a flu shot will give you the flu. And people have been hesitant to get COVID shots. They're afraid because it came onto the market so quickly, and they worry that it's not safe.
Mm-hmm. So hearing these kinds of messages, what can you or what can we all do together to help dispel these myths and misunderstandings around vaccines in general?
So obviously education is one key component. We need to get the message out about the safety of vaccines, but we need to do it in an effective way. And so one of the things I work on in West Baltimore is getting the message out through trusted messengers. So we work with community health workers, many of whom have actually are from the community, to share messages about vaccines. And it comes from somebody that people in the community trust. And so that they're more likely to hear that message than from somebody in the medical institution, for example. And then the other thing is using motivational interviewing. So we're not going to change. Some people are just adamant against vaccines, and we may not change their mind, but we can initiate a conversation with them about vaccines and talk to them about the safety of vaccines, ask them what their concerns are, attempt to address those concerns, let them know about all of the efforts that go into vaccine safety, even after vaccines go on the market, and work with them to move. If they're not ready to get the whole complement of vaccines, which of course I would prefer, work with them to do some risk benefit and maybe choose some vaccines that they're willing to let their children have, and see how that goes, and then go from there.
Do you also try to explore with them where they get their information?
I do. So much of it is from word of mouth, from their parents, from their friends, but also from the media. And I let people know about trusted sources of information. Obviously, the CDC and the American Academy of Pediatrics and ACPM have amazing information. It can be hard to dispel those myths, especially when you have a population that is naturally distrustful.
Yes. Is part of the lack of vaccines, though, a lack of access, or that's not really a concern?
So for children, if people have access to pediatric primary care, they should have access to vaccines. And that could be either in a pediatric practice, a family medicine practice, a federally qualified health center. Most local health departments have offer vaccines. So even if you can't get into a pediatric practice or a private doctor, you should still be able to get shots from the health department. And many health departments have vaccine clinics that you can go to and get the shots. The other thing is that from a funding standpoint, the Vaccines for Children program provides vaccines free of charge to individuals who are on Medicaid, who don't have insurance, and many other populations. So there is a very good system for access to vaccines for children.
Okay, so with access not being a problem, it's more about dispelling the myths. And as preventive medicine physicians, generally as leaders in community health settings or in those settings, what would you say to those preventive medicine physicians, many of whom are on the call here? What can they also do to help colleagues, whether pediatric or family physician colleagues, but also internists and OBGYNs, the other primary care docs, who may not necessarily take care of patients, but who can help to remind the parents of pediatric patients to get vaccines and to get them back on their routine schedule? What can we as preventive medicine physicians do?
Yeah, so I think serving as a ACPM vaccine ambassador is a great way to do it by spreading messages through social media and advocacy. So talking to colleagues, sharing information with colleagues, advocacy at the local and state level to make sure that vaccine clinics are offered, to make sure that requirements for vaccines for school entry continue, because some of those have been questioned, and to make sure that states don't eliminate or states don't add religious exemptions for vaccines, which is a major issue in some states where a lot of families get exemptions, even though it's not really against their religion. And if you work in a community where there is a high rate of vaccine resistance, to work to educate your community, whether that is going out to a community center or a school and talking to parents at a PTA meeting or whatever, any way that you can get the message out is really important.
Yes. And as we know, coming out of the COVID-19 pandemic, which has been devastating, you would think that the value of vaccines would be evident. But what sorts of examples other than COVID? We read about measles outbreaks around the country. Those are the types of things that we can share with parents in particular, because not giving a child a vaccine is not something of benign neglect. It can cause active disease and death. Are there examples that you use in your practice to share when talking about the lack of vaccination, particularly in some communities, as you say, where there may be a high non-uptake because of religious exemptions or other types of exemptions?
Yeah, so Maryland, it doesn't have an issue with major exemptions, but we have seen lack of uptake of vaccines lead to outbreaks. And just, I think in 2019, we had a measles outbreak, and we all know how quickly and how easily measles can spread from one person to another. And we started to have to put up signs about symptoms of measles before people came into the building. We had to screen for measles, and I reinforced the risks of measles and the high rate of encephalitis and pneumonia. So 1 in 20 kids can get pneumonia from measles, and just how much less risky the vaccine is. So 1 in a million chance of having any problems from the vaccine versus more than 1 in 20 from having complications from measles.
Right. Well, I think evidence is one thing. The other, of course, is the qualitative aspects of, this can be devastating to children, and encephalitis is not an innocuous disease and often can lead to death. So maybe before we take other questions, and I know we've got a number of people online who may want to ask questions, so if you prepare those, in your opinion, not only as somebody who's been a vaccine campaign confident ambassador, but also as a preventive medicine residency director, what is it that you want to tell not only the preventive medicine docs on the call here, but your residents? What do you tell them, and how do you get them to become active as leaders in delivering vaccines for children and adults?
Well, one of the things that I do is I teach the Intro to Preventive Medicine course for our preventive medicine residents, and I have a whole talk on vaccines and how they work and how the system in the US works to keep vaccines safe. So we talk about the vaccine, we talk about VAERS, and we talk about all of the other systems to track any vaccine complications, to make sure that vaccines are safe even after they reach the market. During the COVID pandemic, several of our residents worked with the health department to do outreach to increase the uptake of COVID vaccines in the community. We have residents who work with the Maryland Department of Health Center for Maternal and Child Health, and they have an opportunity to work on immunization projects there. And working with other organizations, whether that's ACPM, we have a local chapter of the AAP, and I do advocacy with them. There was recently a bill, I think in the last Maryland legislative session, that was going to require that providers share all of these negative effects of HPV vaccine, which were all complete bunk. And we worked with the American Academy of Pediatrics Maryland chapter to fight this bill. And I invite my preventive medicine residents to join me in participating in those calls if they have an interest, because vaccine issues often come up.
Right. And I think that's an important aspect. I think public policy can be shaped with evidence, and also making sure people understand that once a vaccine gets on the market, like a drug, there is constant adverse event reporting review. So for vaccines in particular, they're the only segment of the biopharmaceutical industry where reporting is mandatory for adverse events. For the rest of drugs, etc., it's a voluntary reporting system. But for vaccines, it's actually mandatory that we as physicians or healthcare providers report adverse events. And then they go to FDA, and in conjunction with CDC, they do constant evaluation. So it's not as though a vaccine gets approved and it never gets looked at again. And I think people need to understand that the adverse event reporting system that exists for both drugs and vaccines, but particularly for vaccines where it's mandatory, these vaccines get reported, the adverse events get reported, and they get evaluated. So all the companies that make all of these vaccines, and there are a number of large companies in the United States and globally, they have an obligation to report these adverse events to the FDA, and then those get evaluated in aggregate. So vaccines are routinely reviewed, and people need to know that this is something that the federal government takes seriously, companies have to take seriously, and it's all about protecting the safety of the patients who get these. So that's a part of the message we need to strive and get out, that once approved, it's not that it's never again reviewed, it's constantly reviewed. And the safety of vaccines, the safety of all drugs is taken very seriously. All right.
Yeah, and even beyond the vaccine adverse event reporting system, there are other methods of surveillance systems where they look at medical records from health plans and compare adverse events among people who have vaccinated, people who have not been vaccinated, to do the research. So VAERS is great because it's mandatory reporting and you get a lot of information. There's also a lot of noise. The other methods are, I guess, more scientific in that they can do case control studies and things like that to get a better sense of whether there are associations between the adverse events and the vaccines.
Right. And as you mentioned, vaccine hesitancy isn't new. Didn't start with COVID. It has been around for decades and decades. And perhaps one of the saddest of these is the Andrew Wakefield article related to mumps, measles, rubella, and autism that was eventually withdrawn. I think it was published in the Lancet. But that had, many people not getting their children vaccinated against mumps, measles, and rubella. And again, vaccine hesitancy and a lot of these myths come from evidence-free types of papers or messages, and we've got to make sure that we take the time and effort and counter them. Otherwise, those messages take root. Patients, children don't get vaccinated, with sometimes catastrophic consequences. Well, thank you very much for presenting to us. I'm going to ask Amy Burdick from BRG to open the forum, and questions will come to both of us. Dr. Lane. Amy?
All right. Thank you, Dr. Rahman. Yes, so at this time, we'll open up the forum. If there's anyone in the audience that has any questions for either Dr. Rahman or Dr. Lane to answer, please go ahead and list your question in the chat box and we'll have them answer it directly. We did have one question sent to us already. Dr. Lane, for you, as an ambassador, is there a particular resource you've found successful or helpful in sharing with patients or caregivers who are hesitant?
So there are great messages put out by ACPM and about vaccines that can easily be shared on social media or handed out. There's great information, as I said, in the CDC. The CHOP Vaccine Safety Center has some great information. And sometimes it's just having conversations and knowing about how vaccine safety works so that you can share that information.
Looks like we have another question. Someone is asking if your curriculum or presentation that's given to med students available to ACPM members, or if there's any other resources you could share there.
Sure. So at the moment, my presentation that I do for the preventive medicine residents and our MPH students isn't available to ACPM. We can have further conversation about that. A lot of my information is from the CDC website. There's something called the CDC Pink Book, which provides a ton of information about how vaccines are made and about the safety, and a lot of the information from my talk comes from there, and it gets updated very frequently.
Yes, and for those folks who don't know about the Pink Book, it's worthwhile going to the CDC's website and taking a look at it. It's called the Pink Book. It used to be a literal pink book that they used to produce in hard copy, but I think those days are long gone. The name remains, however, but it's a fantastic resource.
Great. And Dr. Rahman, we have a question for you. What do you see as the most critical role preventive medicine physicians can play in dispelling misinformation?
We as preventive medicine physicians need to, with very clear evidence and data, challenge statements that are false. Sometimes we are too polite and don't want to be confrontational. I'm not saying to go pick a fight, but I think in a very firm, realistic, and disciplined way, make the case why what we're saying is correct, use the evidence to make that case, and challenge people directly. Unfortunately, we try to maybe go along and get along, but this is a case of lives. This is a case of morbidity and mortality, and we cannot try to be accommodating to so many of these incorrect and false assertions, because children and others will die as a result.
Great, thank you. And then just as a reminder, if you have any questions, please put them clearly in the chat box, and we'll have them answer at this time.
I think, Amy, while we wait for a couple of questions more to come in, if we can go back up a couple of slides, I think to some of the resources that were covered by Maureen earlier, and the resources that, I think slides 8 and 9. Yeah, and the one before, I think, had some resources, and maybe some of this can be talked about how it's used. And Dr. Lane, talking about, you have campaigns, you talked about having community leaders. When you provide these resources to them, is it at churches? Is it health fairs? Where do you go out and utilize these resources with most effect?
So our community health workers go meet people in a lot of different ways. Sometimes it's in healthcare settings, sometimes it is at community health events, sometimes it's at schools, at daycares, at community centers, at family support centers, anywhere they can reach parents, they do. And so any kind of community event or city-wide event, they set up a table and they offer information.
Great. And here are the toolkit materials, I know. Do you have any other questions, Amy? Otherwise, maybe we can transition to the toolkit materials and go through these. Because I think, as Dr. Lane has mentioned, when you go out to any of these functions, taking the material here and sharing with the people who are present would be helpful to dispelling the myths that they have heard.
Certainly, and thank you. Thank you both for that very informative Q&A. And as Dr. Rahman and Dr. Lane have both mentioned, many of you may be familiar with these tools. This is the original Vaccine Confident Toolkit that was developed, constantly updated with the latest facts and statistics around vaccines to keep it, a very useful tool to have in your back pocket, whether you're sharing with colleagues, community, patients. And so not only do we have this toolkit, but we also developed a set of pediatric focused materials as well, just so that you can have in one place the CDC recommended guidelines of pediatric vaccines, talking points for media, different facts and statistics, just to help really dispel any misinformation around it in one toolkit for you to have. Great. And Noah from ACPM has put the link to the tools here in the chat box for you all to access them. And if there are no further questions around the tools, Dr. Rahman, I will hand it to you for closing remarks.
Sure. Well, thank you to BRG and to you, Amy and Maureen, for coordinating this Vaccine Confident Pediatric Rally with Noah from the ACPM and Kate Shreve. I also want to thank Dr. Wendy Lane for A, being an ambassador, and B, coming on the program and sharing her experiences as a pediatrician, as a preventive medicine physician, as a Vaccine Confident campaign ambassador. Also, I'd ask that the people who are here and or who will look and listen to this video later on to take the effort to sign up to become an ambassador. That information will be sent to you. If you are interested, you can reach out to the ACPM. And then you can access the materials in the link that was provided, because getting access to the material is important if you're going to go out. Again, this has been a great program that we are trying to get more people to join us in the Vaccine Confident campaign with a focus here on pediatrics. And it's one of the things, or one of the initiatives of the ACPM embarked upon in 2021 that we need to continue to do. In many ways, preventive medicine is about doing these things over and over, driving the message home, because the people change. Those who had kids 10 years ago, 20 years ago are different than the people you're talking to now. So that you've got to get the message out to them to make sure that they are getting their children appropriately vaccinated, not only for getting into school and meeting the requirements, but in protecting them against preventable diseases. At a time when we have the ability to do that, we've got to make sure that we get this done fully. And the partial vaccination in communities just leads to potential outbreaks, and we should not be having that in 2023 and beyond. So it's important for you all to contribute, to get involved in the Vaccine Confident campaign so that we can protect our nation's children and keep getting them the vaccines they need to ensure their health and safety in an ongoing manner. Please take the time also to share on social media to get the message out. Sign up to do an event in your local community and pass on these Vaccine Confident messages and tools to anyone who can use them. I know in the height of the COVID-19 pandemic, when I volunteered to give vaccines, there were the Pennsylvania Pharmacists Organization, and I passed on the Vaccine Confident information to them, and they disseminated it and used it widely. We've got to think of our fellow healthcare providers who may not be preventive medicine physicians, but we have an opportunity to share what we have, what has already been prepared with nurses, pharmacists, nurse practitioners, physicians assistants, and our fellow primary care physicians and healthcare providers to get the message out. So we are confident in vaccines. Vaccines do protect children, adults against diseases that can lead to significant morbidity and mortality. So let's keep getting the message out, and let's keep aggressively confronting the myths with evidence-based medicine to make sure we protect the safety of all. Thank you very much.